Hello and welcome to Skills to Pay the Bills. We have a great show for you today. Our panel of experts is going to hopefully demystify the basic facts concerning the, you guessed it, Affordable Health Care Act. Please welcome Shirley Luu, host and co-producer of The Real Secrets of Money, and she's also executive field chairman for First Financial Security, Inc. Along with her, we have our old veteran, the handsome Bobby Lee, area marketing director for the First Financial Security, Inc. And we also have another veteran with us, Michelle Overton, managing member of Sage Solutions GTM LLC. Hello, guys. How are you doing today?
Hi. How you
Great,
doing, Tia?
great.
Good.
Thank you, Tia.
Good. Well, listen, we're going to jump right into this, really sometimes volatile subject. And I'm going to start out saying that I have heard people actually arguing about how they love the Affordable Health Care Act, but they hate Obamacare. And I'm under the opinion that they're one of the same, but I'm going to ask you subject matter experts if you can demystify that. Are there two separate health mandates out there? Are they?
No,
Shirley.
actually, they're one and the same. Okay? And it's really funny because you brought that up. A lot of time if I said to, let's say I work some of the nail technician, and I said affordable health care, they'll look at me like, I don't get it. When I say Obamacare, it goes, yeah, I got it, But they are technically one and the same, But the true name of it is really Affordable Care Act.
Okay.
That is the true name of it.
Okay.
But I guess because it comes under,
Right.
it's President Obama's initiative, so therefore everybody kind of know it as Obamacare.
Right, that's
Okay.
right. Well, Bobby, what about you? Have you run into that problem with people mixed up about, which is which?
I tell you what, most people I talk to don't know the difference.
They don't know the difference?
No, and they a lot of them, that's a misconception. And if I tell them about Affordable Care Act versus Obamacare, they have an opinion on both.
They do? Michelle, what about you? What have
About
you?
the same here. Usually if they say that, I just try to let them know it's the same thing. So.
Okay. Well, Bobby, some business owners and individuals alike, they think that by paying the penalty, that's a lot better and that they can get away by paying the penalty. What would you tell a person that was considering doing that?
Well, one thing about Obamacare is that it does help you if your income is a certain level above the poverty threshold. So it does help you, give you subsidies. But for those that don't qualify for the subsidies, it could be a little bit more expensive. Mm-hmm. But if they can afford it, I say, get the health care because if something happens, you don't have that protection. Okay? But if you don't get the health care, you can get penalized. For example, if for a single adult, if you don't get the health care, you're going to get penalized $95, and for a child, $47.50, up to $285 per family, or 1% of the family income.
Of the entire family income?
Yes, which a lot of people don't know that.
Oh.
So, they have to weigh, their penalties versus having the health care, and, be careful when they do choose not to have it.
Right.
Do talk to somebody that knows about the affordable health care and explain to them what the penalties are.
Okay. Now, Michelle, let me ask you this. Is there more than one way to get a health policy?
Oh,
Do you have options?
You still have options. You can go through. There's like 6 or 7 options. You can, if you're lucky, you can get it through your employer, or you can buy it yourself individually. You can purchase on just go into the regular insurer, the private insurer. You can go that route, or you can go on the exchange. This is what they're called marketplaces now.
Okay.
So you can go on a state exchange, like DC and Maryland. They set up their own state exchanges. I think DC's is called DC HealthLink, and Maryland is called Maryland Connect. So you purchase the insurance through there. Now, if you have a state that perhaps didn't, there are states that didn't set up exchanges, so that you have to go through the federal. Like for Virginians, we would go through the federal marketplace. So just go on healthcare.gov and select your state, and you can go through there and purchase. Another option is Medicaid, depending on how far below you are poverty level, your income. Once you do, if you go through healthcare.gov or through the exchanges, marketplaces rather, and you submit your application during that time of submission, they're going to make an assessment anyway to see if you really qualify for Medicaid.
Okay.
And so if you do, then they will transfer your information to that state's, the equivalent of the state's Medicaid program. So the thing is, there's some states that didn't participate in the Medicaid expansion. So you have to check and see if your state is part of that expansion. The other thing is Medicare. If you're over 65, that's another program. That's the Medicare program. And some people have actually gotten a little confused because you can't, Medicare and the Affordable Care Act, they're two separate things. So if you're over 65, you shouldn't be trying to go on the ACA exchanges rather. So you just need to stick with Medicare. That's a separate entity, a separate program rather.
Separate program.
So I mean, there are different ways to get your health care in this country.
Okay, that's good. I didn't realize that there were 7. I mean, that's...
Yes, yeah.
Shirley, now there's some people that are complaining that, oh, the carrier only has one, plan, and so is there just one plan per carrier, or do people have options on several types of plans?
It's funny that you asked me that because, right now there's so much confusion out there because even if you try to go on the exchange yourself and try to apply yourself, I had one cases where this client calls me and then she goes, I did it, I went in and applied online and I got my plan selected. And then she said, well, if you would have helped me out, what plan would you give me, And so I gave her a plan that after discussing with her, I felt that, okay, going to the doctor, you get paid $30, $40 and all that's pretty good. So she agreed. And then to find out, guess what happened? She goes, but the prices you gave me sound kind of high. And I said, well, I'm working with the same government website, so it can't be. I said, so what plan did you select? Because remember, there's catastrophic, there's bronze, there's silver, there's gold, there's platinum. So she picked the lowest plan where it was lower cost, but she failed to look at the deductible so high. So just one carrier alone, it's got over 20 plans. I mean,
wow.
So me as an agent even alone, have to really scrutinize the plan, what it offers for my client and what the needs are, to pick the right one for the client, because not everybody needs the same plan, okay?
Well, you're talking about the metals, the gold and the platinum and bronze. Do they offer different benefits?
Absolutely,
Can you
absolutely.
tell us a little bit about
Yeah.
what is, I guess the lowest is the bronze, is that the?
Yeah, the lowest is the bronze, and a lot of them, it's called health saving account, and a lot of bronze plans is pretty much, okay, you've got, let's say, $6,000 deductible or $3,000 deductible. That means even going to a doctor could be normally cost, $30 in other plan, whereas this, if the bill is $160, you have to put that $160 out first. Yeah, you may save a little money, but then you have to put all upfront cost of the deductible before they'll pay anything. And that's something that people really need to understand, that they need to have someone to be able to guide them and show them the way how it's done. And in a lot of cases, some of these clients came to me, it's too late. Once you select the plan, you're locked in for 1 year.
I thought you could make a change
Not-
if you hadn't paid. I mean,
Yeah, no. In this particular case, even though they hadn't paid, but because they have made final submission on that, they are locked up for 1 year. Now they're trying to change the plan. It's like too late, too bad, you won't be able to do it.
well, many people tell me that they've been on all of the the CMS, the .gov one you mentioned, and the DC connection, and they get on and they say how beautiful the websites are, but they're confusing. So how can people get help? Because I imagine that's high frustration when you're on something and you don't know what to click, and you click something and it doesn't take you where you thought you were going.
Well, when you go on the healthcare.gov, you have the option to do it online, where you can just kind of put in your information yourself, or you can call the 1-800 number and have somebody help you, gather on all that information.
Is somebody answering that 1-800 number?
It's getting better.
Okay.
It's
All
getting
right.
better. But then you have agents like us who can help you step by step, and most importantly, like Shirley just said earlier, explain the details of the plans. Okay, and that's something that when you call 1-800.gov, you won't be able to get that kind of service, because with us, we can sit down with you, we can explain every detail of the plan to see what would be good for you as a client, as far as, what you want to pay, what you're getting back, or, you're going to put money up front before the deductible, or you're going to have a copay when you go to a doctor's. So we can sit down and really explain and find the best plan for you.
Okay. All right, that's good. So it is good to try to have somebody. And are the agents certified, or is?
We all have to be certified with
Okay.
the marketplace before we can even discuss, anything that pertains to the marketplace. So yes, we are certified to
Okay.
do so.
All right.
Yeah.
Shirley, do you and Michelle have anything you want to add about why it's important to have a certified agent helping through the process?
Well, yeah, because they can direct you to what's really best for you. So if you use an agent or you use one of the assisters, they have assisters and navigators as well. They will help guide you along the whole process, because it can be daunting to someone who's never done it before.
And then, it was interesting the other day. I think you were with me. We walked into this one center, and so I met this old man, and he's like in the 70s, and he's getting Medicare.
Mm-hmm.
And then next thing you know, he said, with this new Obamacare thing, can I get it? Of course, no. The answer is because you're over 65.
Right,
And
right.
he said, but my wife, she went to the state and she can't qualify for the state Medicaid because she makes too much money. But she don't make a lot of money. She makes about $13,000 a year.
That's not a lot of money.
No, that's not a lot of money. But guess what? Under the current state, Medicaid program, something like that, under her thing, she couldn't get it. So she's between a rock and hard places. She don't make enough to really, to qualify.
Right.
So, but guess what? Under this particular program, I was able to offer her a plan that it was very minimum cost for her and was affordable, that she could get, and now she has health coverage.
Oh, that's
and
good.
it's so funny because he's an artist, so he's like, I'll paint you any pictures you want.
That's so nice. Well, listen, it is time for a short station break. We'll be right back with our special guest, so don't touch that dial.
We need your feedback. If you enjoyed this show or any of our programming on Channel 10, Channel 30, Channel 36, or Channel 37, please let us know. Leave a quick comment on our viewer comment line. Share your thoughts.
Hi, welcome back. You're watching Skills to Pay the Bills. Our topic today is Demystifying the Affordable Health Care Act. So we're going to welcome back our healthcare panelists, Shirley Luu, Bobby Lee, and Michelle Overton. Have a question about the 10 essential health benefits. This is something that we've never had before. I think before each carrier could have whatever they wanted. Now everybody is supposed to be on the same page. Can you guys talk a little bit about what those 10 essential health benefits are?
Right, and these are the benefits that make sure you have really good coverage and you don't have like a bad plan or a junk plan, as they used to be called, but just to make sure you have a good quality plan. And so here's some of them. Number one is like outpatient care, and that's the kind you get without being admitted to the hospital. So all these plans now must include the outpatient care, trips to the emergency room, that's covered, treatment in the hospital for inpatient care, that's covered, care before and after your baby's born,
Oh, okay.
mental health and substance use disorder services, and this includes behavioral health treatment, counseling, and psychotherapy. Of course, your prescription drugs are covered. Also, services and medical devices to help you recover if you're injured or if you have a disability or chronic condition. And this would include physical and occupational therapy, speech language pathology, psychiatric rehabilitation, and even more. Also, your lab tests, preventative services. This is including counseling, screenings, and vaccines, and that's to help keep you healthy, and care for managing chronic diseases. Also, there's pediatric services. And this includes the dental and the vision for children. That's mandatory.
What about for adults?
That's the thing. The dental can be bought in some of the plans it's embedded, but you have to really look at your plans. I think like in Kaiser, they may have some dental embedded. But for the dental and vision for adults is not mandatory. So they have to buy those like as standalone plans.
So Bobby, what would a person do like if they needed dental? Because most adults need dental.
And they would have to look for the companies out there that sell the plans as standalone plans.
So is this on the marketplace?
Well, actually,
okay.
that's one thing you can do even on the marketplace because, for example, Care First in some area, they do offer, I can pick a regular plan, and Care First do offer some dental plan. For example, a month, an individual could pay $18, for example, okay, to have a dental plan, So there's a fees for whether it's individual, what they pay per month,
right.
And again, they can apply for that, like
that's
Bobby said.
great.
Yeah, so it's kind of pretty neat. Kaiser tends to include the dental plan.
The dental plans.
dental
That's
plans,
good.
Yeah.
Also, I want to add, you can't be denied health care with the Obamacare. So that's part of the essentials. That
What about
you-
existing?
Existing condition doesn't matter. There's no health screening. You can't be denied regardless.
That's a good thing. That is a
Yes.
good thing. Well, let's talk about some terms because a lot of times we just take it for granted that people understand what some of the terms are, such as deductibles and coinsurance and copays. Can you distinguish between those?
All right. Well, with any healthcare plan, of course, we have deductibles. Some plans might not, but if you do have deductible, what happens with that is if anything happens where you go to a hospital, you have to put that money up front. Okay, on some plans, you might have to put that money up front for doctor visits. So it's very important to understand that. And there's the coinsurance. After you satisfy the deductible, the coinsurance basically could be 70-30, 80-20, which means if you had an 80-20, after you pay the deductible, the insurance company is going to be responsible for 80% of the cost, and you 20%.
Now, a question there. Let's say you got a $500,000 hospital bill, and the insurance company carrier is going to pick up 80%. So the 20% is what the family or the individual picks up?
Well, there is what they call a max out of pocket,
Okay.
which will protect you from that. Okay?
Oh, okay.
Where if the 20% is over a certain amount, there is a cap that the maximum amount you're going to put out of pocket for the year, say, is like $6,000, and your deductible is $3,000. So no matter how high your bill is, the max amount money that you will put out is $6,000 if that's your max out of pocket.
Okay. Let's say that I don't have the $6,000 up front. I need to make a payment plan. Will the doctors or the hospital or emergency room, will they let me work out a payment plan, or do you have to have that money?
Well, they will allow you to work out some kind of
They
payment
will?
plan.
Okay, that's
Yes.
good. That's very interesting. Michelle, were you about to say something
Oh, no,
about
that's
that?
good.
Okay.
Oh, and also in the plan, there's copays. That's when you go to a doctor visit and you have a copay. So that's what you put out. It's like $30 or $40 for doctor visits, and sometimes that goes into the deductible, sometimes it doesn't. And that's something that a lot of people need to understand also.
Okay. What about waivers? Are there any waivers for people? Like if somebody is just at the just poverty level, they just don't.
Well, with the Affordable Care Act, if you have financial hardship, you can be exempt. You don't have to get an insurance policy. You won't be penalized. Or if you have legitimate religious objections,
Okay.
or if you're under the poverty threshold,
Right.
or if you're an American Indian or an Alaskan, and also if you are incarcerated.
Oh, okay.
These are the events that what they call triggering
Trigger.
events
Triggering.
that will that can exempt you from getting the policy.
Well, I've saved the best for almost last, and that was employers, because that seems to have been more volatile than anything else under the Obamacare mandate. So what is the story with employers? You hear that some have been exempted and they didn't have to do anything for 2013, but in 2014, is it 25 employees, 50? There's all kind of craziness about, to me, 40 hours a week is a work week, but under the plan, I think they use 30 hours, and it's some kind of formula. Can you all help to demystify some of that?
Well, the most important thing is, you have to get, the employers need to really get with their tax advisors, because they have to really determine what full-time employee is, and the employees have to be counted, because if they have full-time and part-time, the most important thing is that you have to determine if you have a small business or a large business. And from the research we've done in some of the classes, we found out is that sometimes you're a small employer, but when they actually do the counting of the full-time and the part-time employees, you may end up being a large employer.
Ooh.
And sometimes you're a large employer, but after they end up properly counting the full-time and the part-time employees, you may actually be a smaller employer. So that's,
Wow.
They have calculations that are done, and the best thing is for these employers to really get with their tax advisors, because they really know your CPA, people who help you with your taxes, to make sure you get a proper employee count.
Right.
Yeah.
Shirley?
Yeah, and I think the other reason, very important too, is you hear millions of Americans got dropped from
Yeah.
insurance, right?
Yeah.
And one of the reasons why it got dropped is because even individual outside, whether it's company or individual plan, it did not, I repeat, it did not meet the 10 essential requirements of the healthcare situation.
Okay.
And because it didn't meet that, so therefore automatically say, whoops, you no longer have. I mean, my son was a great example. He had a plan, paid it on time, everything is good, and suddenly Aetna came back and said, sorry, we no longer honor that. You have to go pick a different plan.
Oh, wow.
Yeah, so that's the reason why so many people get dropped and things like that. And then also with the mandates, and sometimes it may cost employers so much more money with the new cost rising. Mm-hmm. And a lot of employers say, well, we're not going to do this. Mm-hmm. And some employer, because of the hours changes and all that. Right. So that's whole dynamic that's going on.
Well, what about penalties for employers? Aren't they going to be heavily penalized if they don't follow certain mandates?
Well, again, that's going back to what Shirley was saying. If they offer unaffordable plans, if it's not affordable to the employee or to the employer, or if it wasn't a good plan, it wasn't like with the 10 essential health benefits, that's a trigger. Also, if some employees, if they're like large ones, and that's going back to, again, establishing whether you're a large company or a small company, if they don't offer the plans and the employees go out to the marketplace and they purchase, that could trigger penalties for the employer too. But the most important thing, they really got to get with their tax advisor and establish whether they're a large business or a small business, and that means to properly count those employees, the full-time and the part-time, to see what they really, really have.
Well, employers, we talked about the employees, needing to have a certified agent to help them through the process. What about for employers? Do they also need to consider having a certified agent helping them through the process? Because I would think that they're the ones that are going to have to initially go on and fill out these applications, and they're probably getting different types of questions.
And definitely, I mean, we can come in and kind of show them what options they have based on their employment situation, and we can really sit down and show them the right path to go, where it could save them money, because if they get a plan through the marketplace, it could be tax deductible, or the fact that whether they'll get penalized or not. So definitely, they need to work with one of us so that we can really show them the right thing to do.
Right. Well, we don't have a lot of time left, but I think we have enough time to hear some testimonies. I know you guys have really been out in the field talking to different people. What is out there in the field? What are people saying? Are they generally upset and angry about it, or are they now willing to, at least take a look at it?
Well, from what I've seen, people don't understand it.
They don't understand it.
And that's the one thing that we do, is that we really can go out there and help them.
Right.
Understand and guide them through this whole big mess.
Right. Well, I understand. Well, it is almost time to close. So in closing our segment today on demystifying the Affordable Health Care Act, let me encourage you to do 3 things. 1, spend a little time doing research yourself on this important mandate. Don't let me or any other media component or newspaper define what is true or false about this important law. Go to www.healthcare.gov portal and do your own due diligence. Prove whether or not what others are telling you is true or false. Number 2, don't wait until a catastrophic situation occurs to try and learn about the healthcare component. Get involved right now. Number 3, get help. You don't have to go through the process alone. You can call Michelle, Shirley, or Bobby and get advice on the healthcare mandate. They have been certified by CMS and others on the marketplace to give you assistance. You can also call your local state exchange and seek their assistance. Now, go find something to write with and a sheet of paper and take down the important numbers and websites that will be scrolling on your television screen as we close. Thank you so much for watching Skills to Pay the Bills.